I know that you were not in your current position when all of these decisions were made, but we have this report that's due out tomorrow that even before it came out, a lot of people were debating and arguing over its findings, and that was about the nursing home deaths. It was a very controversial policy that was installed early on. It didn't seem to make sense to a lot of people to put COVID positive patients into a very dangerous, it would seem, and vulnerable population like nursing homes and long-term care facilities. But it seems that, at least according to what we're going to see in this report tomorrow, that the count of those deaths that occurred in those places was maybe off by about 1,000 or so. Give me your reaction to what you've heard so far and what we need to do about it.
Well, Devin, it's difficult for me to comment on things that occurred before I was both working at the state and actually before I was even in Michigan. However, I can say that during the pandemic, what we've really seen is that tough decisions have to be made, sometimes with very little notice as we learn new information and as the virus changes. And so this whole pandemic has just been an opportunity to learn and to be as agile and nimble as possible. And it's difficult, I think, to second guess some of those decisions that were made early on in the pandemic when, again, we were still learning about the virus and learning about how it behaved in certain settings.